Hello everyone, welcome to this session. My name is Iman. I'm from College of Health Sciences. I'm from Medical Imaging Sciences, and today I'm going to talk to you about the collaborative practice of medical imaging technologies. In this session, we will introduce a key concept relating to the interprofessional collaborative teamwork for medical imaging technologists. Interprofessional education has a positive impact on teamwork in daily healthcare practice, and especially for you as students. The learning outcome for this session is to define the role and the responsibility of medical imaging technologists in different imaging modalities in healthcare facility, and to discuss how medical imaging technologists communicate and work together with other healthcare professionals. Medical imaging technologies, as a definition, it's a healthcare profession concerned with imaging the body parts and diagnosing the disorders and disease. That is what we do. We take images from different body parts and then we help with the diagnose and even to see if there is any abnormality or disorders or disease within the patient. What does medical imaging technologist do? Medical imaging technologist is a health professional who works with technology to look inside the body in different ways and different images. We assist actually doctors, physicians, radiologists, surgeons to diagnose, monitor, and to help for the treatment of the patient. You are like the eyes for them. I always refer that to my students that we are actually the eyes for the doctors. Their mission is to help to find out the reason by getting closer look inside the body in form of medical images. This is actually the rule on what we do in our profession. In radiology department, medical imaging technologists works with different techniques and modalities. So we are talking about X-ray, which include fluoroscopy, mammogram, dental, C-arm, CT, computer tomography, MRI, magnetic resonance imaging, ultrasound, and nuclear medicine. First of all, we'll start with the X-ray.
So an X-ray in its most simple form is a little bit like if you imagine you were out in a rainstorm and wherever your hand was, there would be a gap. Essentially, there would be a shadow of your hand on the paving stone. The X-rays go through the patient, and wherever the body has absorbed some of the X radiation, then there will be a gap on the detector below. In the old days, it would have been a film. So people may come for an X-ray because they've broken a bone in the past, had a fractured bone, or if people are thinking of moving to a different country, then a lot of the stipulations for a visa may be that they have to have a chest X-ray.
Yes, so one of the modalities we're using, which is X-ray, you come for the X-ray, you have some kind of ionizing radiation, and then it goes through your body, it penetrates your body, and then it gives us the image that you can see here. For example, this is an image of a chest where you can see the lungs, you can see the bones, and you can see the other soft tissue within this image. This is for chest X-ray. X-ray have different types or different models. We can use them also for other things. For example, we have the mammography, which is the imaging of the breast, where we can detect any abnormalities within the breast. Also, we have dental X-ray, where we use it to evaluate and to diagnose the abnormalities within the teeth and the root canals. We have also the C-arm X-ray, which is a type of the machine of using X-ray inside the theater or the operation room during the surgeries and operations. Another type of X-ray, which is a fluoroscopy, where we can consider it as a live X-ray. You can see the movement of the organs. For example, here we can see the motion of swallowing, and we can see here the coronary artery of the heart, and we can also check and see the heartbeat. Another modality, now the second one is CT scan. CT scan is also a type of modality, so we're going to have a small video to talk about it.
In CT, it's a little bit more advanced. Instead of just being one paving slab, there are lots and lots of them. So they will build up a slice picture, if you like, because the X-ray machine actually revolves around the patient as the patient goes through. Much more complex, and it's a little bit like a bacon slice image. So it's a slice picture, an axial slice picture through the patient's body.
Yeah, so CT scan, it's a slice picture. We're still using X-ray now, but this time we're using a slice, and it produces images this way. Just imagine that you're slicing the body into slices, and this is the product of the images. Next, we have the MRI, magnetic resonance imaging. This is also another type of imaging we use in the department.
MR doesn't use X-rays at all. It uses radio waves and a magnet to make the pictures, and lots of complicated physics. The MR scanning suite is a controlled environment. The magnet is always on, so whether you're a patient or a visitor or a member of staff, you always have to remember never to wear anything metallic in your pockets. MR's a really good diagnostic tool. Not only will it supplement a CT findings, but it will also be a really good tool for looking at the soft tissues in the joints, for example, shoulders, knees, feet and elbows. It's also really good for looking at neuroanatomy of the lumbar spine, so the nerves that come from the lumbar spine. Lots of people have a bad back, and also for the brain as well.
This is another modality. We use the magnet in this modality for magnetic resonance imaging, MRI, and this is one of the images that produced by MRI. Now we have another modality, or we call it the ultrasound. This is the safest type of medical imaging, and we will see what is ultrasound now.
An ultrasound scan is very much like a dolphin's echolocation system. It bounces sound waves off tissues. If you're coming for an ultrasound, you'll be shown into a room where you lie on a couch, and there'll be a machine next to the couch, and then the radiologist or the radiographer will put a transducer against your skin with a bit of coupling jelly, and the transducer is the scanning head.
Yes, this is the ultrasound. This is
an ultrasound scan is
also an ultrasound is because it's very safe. We can use it for scanning pregnant women and to see their babies. And we also now have an advanced practice in ultrasound where we can see a 3D and a 4D of a moving baby, and even we have the HD and HD Live in ultrasound. Last is the nuclear medicine. Nuclear medicine, we want to know what's a nuclear medicine now.
In the nuclear medicine department, a radiopharmaceutical is injected to the patient. Radiopharmaceutical distributes itself in the whole body and concentrates in the disease areas. It is taken up by the lesion, and any residual is naturally eliminated. The patient is then transferred into the camera. Radioactivity allows to provide an image. First pass gives an X-ray picture, and second pass gives a PET or SPECT picture. Fusion gives the PET CT or SPECT CT image. The images allow us to clearly see the lesion location.
So this is about the nuclear medicine. So we give like a drug to the patient, which is give us already a clear image for the as a function, the problem in the function, and then we're using the CT to collaborate them together and then see where is the lesion and where is the problem. This is one of the images we use, we can see in the nuclear medicine. Now, the process and how we communicate, how the medical imaging technologists communicate and work together in the healthcare. Say that we have a patient, so the patient will start coming on, let's say, in the emergency or coming just to see the doctor. You have a problem, you have to go through the nurse and then we'll go through the doctor. Maybe he'll go through the dentist if he have a problem with the dentist with his with teeth, and then they will refer him to the medical imaging technologist depending on his case. For example, if he is suffering from something in the chest, the nurse, the doctor, or even the dentist, if he's suffering something on his teeth to plan his treatment, they will send them to medical imaging department or the radiology department. Our part is to take the image and provide the clear image requested by the doctor or the dentist and then bring it back to them. And then after that, the doctor or the dentist will decide what is they will start to diagnose, the reason of that disease or the illness, and then will refer them either to other investigations or for the others to start management for the treatment. They can be sent to their physiotherapist or for their lab technologists for further examination, or he can also have the help of the anesthesia technologist, maybe in a surgery or in any type of anesthesia procedures. And then maybe they can send them for the pharmacist to get the prescription of the medicine they have to take at the end. So our role actually, it's all, if you can see here, they're all in the circle around the patient. All of us work as a team and each one of them have a role. And we have one of the biggest role actually to help diagnose and see what's the problem. Then we can help the doctors to determine what is the right treatment or how to manage the treatment for this patient.